I'd like to spend a few minutes talking about insulin resistance because it is really responsible for 80% of what kills us humans. Insulin resistance is also responsible for 80% of all healthcare costs. Somehow, most physicians haven't connected the dots. And OptHealth, insulin resistance is a core philosophy of what we are attempting to do, which is to reverse insulin resistance and basically increase insulin sensitivity, which is really the key for longevity. Now, why do we develop insulin resistance? It's very simple. The average American now eats somewhere around 150 pounds of sugar per year, over 200 pounds of grains, and 5,000 teaspoons of adulterated plant oils. Olive oil is great cold, but you should only be cooking with things like butter, ghee, tallow, beef fat, and coconut oil. The only time cholesterol has anything to do with anything is if you oxidize it by cooking with bad plant oils, like canola or safflower oil, etc. So those three things, sugar, grains, some starchy vegetables, but mostly the grains, and these vegetable oils, is really responsible for this incredible pandemic of cardiometabolic disease. It is all being driven by insulin resistance. Insulin was obviously an important hormone that humans developed because insulin is a fat storage hormone. Unfortunately, if you look at our ancestors, and that's a few hundred years ago and before, for millions of years, humans were essentially had no sugars, very few grains, and obviously no bad plant oils. So early humans essentially ate a keto diet with periods of intermittent fasting. So we now know if we mimic our ancestral health from the years before, we can very quickly restore. For instance, many millions of people here in the US have fatty liver disease. Fatty liver disease goes along with insulin resistance. The amazing thing, on a keto diet, you can within a week or two, lose nearly 30% of the fat in the liver. So we have the remedy. We do not need more insulin in type 2 diabetics. It's really, in a way, malpractice. You have to fix insulin resistance primarily with diet and lifestyle changes. So it's very easy to measure your insulin resistance score. In fact, OptHealth has a complimentary IRS insulin resistance score. It's not the IRS tax, the insulin resistance score, which we can do for you to see where in this continuum do you have mild, moderate, or severe insulin resistance. If you have severe insulin resistance, you must reverse it. The other thing is it's the major cause of all erectile dysfunction. If you are in your 40s and 50s and having problem with erectile function, chances are you've got insulin resistance. So it's critically important because if you're having that problem, this is like the canary in the coal mine. It's not too long before you can have some cardiac problems because the vascular system is one system. So you want to be sure that you go and get a coronary calcium score, which we can organize for you to make sure your heart is in good health. Because the first sign of heart disease for 50% of men is sudden death. It should not happen in 2021.